Bad breath, halitosis. No one likes it. It's embarrassing. What causes it? How to treat it? Let's go. Hi guys, welcome to the Tooth Files. My name is Saba, your friendly YouTube dental hygienist, and today we are going to talk about bad breath. What are the causes of it and how you can treat it? Halitosis or oral malodor are clinical terms for bad breath, and whether it's an occasional issue or a chronic problem, it can affect your social, personal, and professional life. Something to keep in mind about chronic bad breath is that sometimes you can develop a tolerance to it, meaning that you won't notice your own bad breath, but everyone else will. But once you know what causes bad breath, you can then look for ways to prevent or treat it. So let's look at 3 common causes of bad breath and some strategies you can use at home to treat it. Number 1. Poor oral hygiene. The most common cause of bad breath is poor oral hygiene. The bacteria that lives in your mouth, and especially those on your tongue, will feed on the food particles left in between your teeth and on your tongue and produce a bad smell. Fortunately, this has an easy solution, and that is to maintain good oral hygiene. Ideally, you should aim to brush your teeth twice a day. You should also try to clean in between your teeth pretty regularly. Whether you're using regular floss, water flossers, interproximal brushes, or a combination of the 3, you want to make sure that the spaces in between your teeth are completely clean. By the way, if you don't like flossing or you've never been able to get into a habit of flossing consistently, I made a whole video about a great flossing alternative. I leave a link for it in the bottom bar below so you can check it out later. There is also a secret weapon to good oral hygiene and fighting bad breath, and that is to use a tongue scraper. More than 80% of the bacteria that causes bad breath lives on the top and the back of your tongue, so make sure to clean it regularly and properly. A tongue scraper can help you clean all the buildup on your tongue. Your goal should be for the top of your tongue to have a pinkish color without any white or yellow coatings. If you don't have access to any tongue scrapers, you can just use your toothbrush to gently clean your tongue. If you are interested in buying a tongue scraper but you don't know which one to buy, I will put links for some options for you in the bottom bar below. Side note, if you wear removable dentures or any other removable dental appliances, make sure to clean them regularly as well. Food can get stuck underneath them and produce a bad smell. Number 2. Dry mouth. Your saliva acts as a cleaning agent for your mouth, so when there's not enough of it, aka dry mouth, it will lead to an increase in bacterial growth, which then cause bad breath. This can be due to the medications you're taking, excessive coffee drinking, or by continuously breathing through your mouth. If you have dry mouth, make sure to drink plenty of water throughout the day. You can also use Biotene products, xylitol mints, and gums to help increase your saliva production. I will put links to some product examples below in case you're interested. Number 3. Diet. Certain foods and beverages like garlic, onion, and alcohol will affect how your breath smells, but this is really just a temporary issue and the bad breath will go away. In the meantime, here are some quick fixes you can use to minimize the odor. Drink green tea. Green tea works like a deodorant for your mouth and it's a great option for fighting bad breath. Eat green vegetables or drink their juices without any added sugar. Vegetables like kale, cucumber, and parsley will help temporarily neutralize the odors in your mouth. You can also use sugar-free mints, gums, or breath sprays. Again, these are all temporary fixes and won't actually eliminate bad breath. Another dietary habit that can temporarily produce bad breath is a ketogenic diet. On a keto diet, you would eat very little carbohydrates and your body starts exhaling ketones, and they have a particular almost nail polish-like smell. Again, this is a temporary issue and also not everyone will experience it. But if you are on a keto diet and you're experiencing bad breath, there are 2 things you can do to help alleviate it. A. Drink plenty of water. This will help your body flush out those ketones through urination rather than exhaling them. And B. Stay consistent with your diet, so your body has time to adjust to this new diet and usually the bad breath will go away. Now, if you don't feel like you have dry mouth and you're staying on top of your at-home oral hygiene, brushing, flossing, tongue scraping, but you're still noticing consistent bad breath, then please make sure to visit your dental hygienist and your dentist and ask them. They will help you get to the root cause. Here are 2 causes that they may diagnose for you. A. Oral diseases and infections. This includes problems like dental decay and gum disease. In the case of gum disease, there's a special type of bacteria that colonizes underneath your gums and produces bad smell. If you have gum disease, you need professional dental cleaning. So please make sure to go for your dental cleanings and checkups regularly. And B, your dental hygienist or your dentist may notice that your chronic bad breath is not related to your mouth and is a sign of another health issue. Sinus problems, diabetes, liver and kidney problems, GI issues like acid reflux can all contribute to bad breath. And in that case, you will need to visit your primary care provider or an ENT specialist. So to recap, halitosis or bad breath is a very common issue. It can be caused by poor oral hygiene, dry mouth, dietary habits, oral infections, or it may be even related to other health issues. Products like mouthwashes and breath sprays will temporarily mask the odors but won't actually treat bad breath. We discussed some strategies you can use at home to prevent and treat bad breath, as well as some quick fixes you can use to minimize the odor. But if none of these solutions are working for you and you're still noticing consistent bad breath, then please make sure to visit your dental hygienist, your dentist, or your primary care provider and ask for help. Alright everyone, thank you so much for watching. I hope you found this video helpful. If you did, please like and subscribe, and I will see you in the next one. Bye!